We have already discussed arthritis and its relationship with uric acid. Arthritis is a broad term for joints inflammation. A joint is a connection between bones. It joins bones to formulate a skeleton. Our mobility and bending are also due to the joints of our bodies. Today, we will briefly cover one type of arthritis, that is rheumatoid arthritis. Rheumatoid arthritis is a chronic disease resulting in the inflammation of joints, particularly the joints of the wrist and feet. The word rheumatoid originates from the Greek word, and its meaning is watery and inflamed. It is an autoimmune disease that is progressive. According to data from 2015, 24.5 million people in the world are affected by rheumatoid arthritis. About 1.5 million of those people are in the United States. And in 2013, 38,000 deaths resulted due to rheumatoid arthritis. Women are 3 times more prone to this disease compared to men. You can say that females contribute 70% of the total affected population. The exact cause behind this joint inflammation is unknown and not understood very well. The immune system attacks the tissue lining of the joints, making them thicken and inflamed. The synovium, which is normally a thin layer around the joints, becomes thick, and it leads to the accumulation of synovial fluid. This fluid provides lubrication for the mobility of joints, thus avoiding friction. Risk factors for rheumatoid arthritis are women, being above 30 years of age, smoking, a family history of the disease, and a hyperactive immune system. Infectious agents like bacteria and viruses can also result in the inflammation of joints. Obesity is also a contributing factor to rheumatoid arthritis. General symptoms of rheumatoid arthritis are swelling, inflammation, and pain. Sometimes there is redness and tenderness and stiffness around the joints. In this condition, the same joint of both sides is affected. So, if the wrist joints of the right hands are affected, then the wrist joint of the left hand will also be affected. Other symptoms include fatigue, low-grade fever, and a loss of appetite. Rheumatoid arthritis is a systemic disease. That means it affects the entire body of a human. This disease affects the organs and other body systems of the body. The cardiovascular system and the respiratory system are mainly disturbed. If rheumatoid arthritis is left untreated, it will ultimately damage cartilage. The space between joints shrinks. This may result in unstable mobility and deformability. So let's talk about the treatments. Treatments include proper medication to stop inflammation as soon as possible, dietary changes, and balancing physical activity. For self-management, nutritionists recommend the anti-inflammatory diet. Also, a Mediterranean diet and foods with high antioxidants are preferable. An affected individual should avoid fast food as it serves as a fuel for inflammatory reactions. Rest is also important to cure rheumatoid arthritis, but a person should also go for low-impact exercise to maintain flexibility and strength of their body. For this purpose, you should always consult a therapist and a physiotherapist. Furthermore, there are some complications reported due to rheumatoid arthritis itself and its medications. These are osteoporosis, in which the bones become weak and more prone to fractures. Cardiovascular inflammation, low red blood cells, and inflammation around lung tissues are observed as a complication of rheumatoid arthritis. The diagnosis of rheumatoid arthritis concludes through medical history like pain and genetic factors, physical examination like swelling, tenderness, and stiffness. A third diagnostic method is a rheumatoid factor. It is an antibody that is common in 80% of affected people. This is not always a suitable method for diagnosis, though, as this antibody is also produced in other inflammatory reactions. Hot or cold baths depend upon a person's situation. Creams and gels can cause temporary relief pain and stiffness sensations. Well, we hope you learned something new today. To learn about almost all types of arthritis and other diseases that are common in today's world, head to our YouTube channel and educate yourself. Also, please share this video in your social circle with friends and family to educate others. And as always, if you have any questions at all, please leave them in the comment section below.